Now we're going to cross the Atlantic, go to a completely different type of country. We're going to go to Canada, we're going to go to Saskatchewan. In the Netherlands, everybody's all crowded together. They haven't much space, they just amble up to the nearest hospital. In Saskatchewan, you have lots of nothing.
We have lots of what?
Nothing. Lots of nothing. You have to go miles and miles. And you're not just designing a hospital, you're the CEO for a whole region.
A whole province.
Whole province.
Yep.
Bonnie, over to you.
Okay. Well, good afternoon, and it's just a delight to be here with you today. And it is fun going from a hospital presentation to a provincial one, and my colleague next will be offering a country's perspective on how to achieve quality. So I'm going to fly through a lot of slides because I erred on the side that I know these are going to be available, so I thought I'll give you as much as I can in the slide deck, but I'm going to be telling a story in the next 20 minutes and ending with some small video from my colleagues back home. So as you hear, we are a province on the west side of the country, and I'd argue that there's not a lot of nothing. There's a lot of very interesting things in our province, but nonetheless, that's where we are. And there is a bit of a myth that there is a thing called a Canadian healthcare system. It's very much a patchwork, and healthcare is delivered provincially. So we have provincial health systems that put their focus and energy on improving quality, and we haven't done a great job at a national level. But that's where we are, about a plane ride of about an hour's length east of Calgary. This is a really important slide, and one that I want you to kind of keep in your mind as I tell my story. And so this shows how we deliver healthcare in the province of Saskatchewan. And the province of Saskatchewan has just over 1 million people, but we are the size of Sweden, a bit bigger than Sweden, or for my American colleagues, we are the size of California and Minnesota. So about 1.8 people per square kilometer. And that's really the bottom half of the province. But as you can see from this slide, we have many hospitals. We joke that Saskatchewan is Cree for too many hospitals, and Cree is the First Nations population in our province, or one of them. You can see that there are multiple nursing homes, and we also work with over 2,000 physicians. So those patches that you see on this slide are those health authorities that are responsible for acute care, long-term care, public health, health promotion, mental health, but we have a parallel system for primary care and specialty care. And so, again, the word system you have to use very carefully. So just to give you some history, I've heard the language over the last 2 days about how quality needs to be your primary business strategy. Well, in 2008, we actually launched a learning collaborative for our leadership community in the province, and really stole shamelessly from the IHI model. And we had a 2-year collaborative where we brought over 250 leaders. These are the chief execs, their VPs, clinical leaders, Ministry of Health. We had the unions, the health professional groups, the academia, all in a room talking about how do we focus our efforts on quality as a business strategy. And in my 20 years working in the Saskatchewan healthcare system, I can tell you these were probably some of the hardest and most crucial conversations that we have had. And they really have set the foundation for how we're working going forward. As part of that learning collaborative, we had the privilege of learning from people from away. So we had the privilege of learning from Helen Bevan, the folks from Yongshiping, Doug Eby and colleagues from South Central Foundation. And it's probably the folks from the South Central Foundation that really influenced a pivotal policy document that came out of our province. And that policy document is known as the Patient First Review. So what we like to do in Canada is write white papers and think that we're really important because we, working in the health system, have a great understanding about what the problems are and how to fix them. But when we heard about hearing the voice of the customer owner from Alaska, we flipped it and we said, if we are going to do a review, let's start and end the conversation with the voice of the patients and their family members. And so this is what this review engendered. It engendered a conversation with dozens and dozens of people in the province. We asked them, what do you like best about our health system? What needs fixing? And the candor of those conversations were amazing. And the humility that was engendered was again, equally wonderful. So this was the beginning of what you might hear again in some of the conversations that you've been a part of over the last 2 days. It was the starting of a shared purpose. That we needed to always put the patient first in every decision and every discussion and every improvement conversation and activity that we were having in the province. And so that set us on our stage. Now, my presentation is about how we think about strategic planning and how we are embracing strategic planning at a jurisdictional or at that provincial level. So what you see here was our first expression of how we do that, because typically or historically what would happen is that the Ministry of Health would go in their cave and they would come out and say, look, health system, this is what you need to achieve, with very little to no dialogue with providers, patients and families, and other primary or other health providers in the system. And so again, the quality as a business collaborative, the patient first review, it compelled us to start working differently. And this is just a picture of what the first expression looked like of how do we think about what do we need to accomplish at a provincial level. But I'll be honest, just like Ernest Hemingway said, the first draft of anything is you know what, so was the first effort. It really wasn't very good, but what was really important is that we made a commitment to work differently. So instead of having 60 strategic plans for each and every hospital, or 100 additional strategic plans for those long-term care facilities, we now have a health system strategic plan that now cascades throughout our province. We like to steal shamelessly, as I've alluded to, and we love the triple aim. To make it more like what we think of in Saskatchewan, we call it the triple aim plus, because as I hope you can see from this slide, is that it is all about better health, better care, better values, and we've added better teams, because we don't believe you can achieve those first three aims without a robust, strong healthcare team working front and center for the people of the province of Saskatchewan. So this strategic intent, again, was developed by all of those leaders in the room. All 250 rolled up their sleeves and said, what are our values? What do we want to accomplish? And what's the foundation for our health system? And I think equally important is the foundation: patient and family-centered care, think and act as a system, continuous improvement, and a culture of safety. So a really big piece of our history is what's happening now, and it started in 2011, and it was this notion of how do we become a world-class management system. And we made the decision as a province in 2011 to commit to using lean methodology and principles as our principal improvement methodology. And as part of that methodology, you need to have three facets to a high-performing or world-class management system. You have to be focused on continuous daily management, you have to be thinking and acting in terms of cross-functional management, and then there's this piece called Hoshin Kanri. And I'm curious, how many people in the room know what Hoshin Kanri is or were familiar with the term? Can you put up your hands? So that's delightful, because there's less than a handful. So what that says to me is that you are a very curious bunch, and I think curiosity is one of the hallmarks of fine leadership. When you look at implementing a world-class management system, the books would say this is how you do it. You get your organization, you get your jurisdiction, your health system working and firing and competent and capable when it comes to daily management. And then you advance to thinking about how do you do cross-functional management. We know those transitions are so gnarly and so challenging. How do you do it? And then once you've got that, then step back and start thinking about how to apply strategic management thinking in this new way of working. So that's what the books say you're supposed to do. Well, this is how we tried it and are trying it in the province. And, you know, there's many reasons that I can tell you offline why we did it, but it is what we're doing. And, you know, that's not to say that we were starting from scratch. We had 10 years of a lot of pockets of quality improvement throughout our province, again, but what's different is that we've all made a commitment to use lean methodology. And I could do another presentation on how we're approaching that as a system. We have gone into a pretty major contract and relationship with a consultancy group that did support Virginia Mason in its early years. And this is a consultancy group, John Black and Associates, that are hard as you know what in terms of the discipline and rigor. But we felt that's what we needed to take it to the next level. So again, a lot of slides are going to be flying across the screen that speak about what is Hoshin Kanri. And I guess this slide sums it up fairly quickly. And when you look at that slide, you say, well, what's unique about that? That sounds like balanced scorecard. That looks like pretty boilerplate strategic planning and management. I would say what is fundamentally different, what I've seen so far, is the process behind it and the real, meaningful, and intentional conversations that this method gives you when you're talking and deploying strategy. Hoshin Kanri does come from the Japanese language, and it basically means compass or direction, so it means focusing and focusing in alignment, which Rob previously spoke about. It really means, we have a great saying in Saskatchewan, and maybe you do too, if everything's a priority, nothing's a priority. And so it is really speaking to how do we focus and finish? How do we focus on a few key improvements? Maybe you call that transformation versus transactional, I don't know. How do you align your entire organization, or in our context, the entire province of Saskatchewan, so that we can make improvements on these breakthrough initiatives? But I think what's really critical is the shared input, the participation of people, right from the coalface of care all the way up to the senior execs, including the Ministry of Health. I think this is another important slide that helps people see the complement between daily improvement and breakthrough improvement. So don't fall into the fool's choice that thinking that it's one or the other. It's both and. And Rob mentioned an organization called Theta Care. Theta Care is a wonderful health system in the U.S. to learn from, and they'll often say that actually you get some of your pretty impressive improvement from your daily management and not necessarily from your breakthrough. So don't think of it as an either or, but a both and. But what we understand about incremental versus breakthrough is that you're trying to get to your ambitions quicker, and if you focus and finish, you will. So this might be another helpful slide. It basically describes what's our process. How do we start this thing called Hoshin Kanri? And it is like a macro PDSA. We start every year now in the summer, and we end up with our strategic plan for the upcoming year by the end of March. And what's so exciting is historically budgets would determine plans. Now plans are determining budgets. And there's lots of steps in here, and again, my slides are going to talk about it in very rapid detail. When you're talking at a health system level, you have to think about a number of levels. So there's a provincial leadership team, and I sit on that team alongside all of my colleagues who own patches in that picture of the province. Then there's levels at the senior executive level in the organizations, to directors, to managers, to point of care staff. So what we are doing very differently now is, again, before, strategic planning conversations would typically stay at level 1 or level 2, but now they're going all the way through to level 5 in some of those big organizations and all the way back up. This is our second effort. We've just finished it last year. We're going into year 3 of our experience with this Hoshin Kanri. So we're still early out the gate, but just to sort of put a caveat. So you start with diagnosis and review. You start with saying, so what is our data telling us in terms of our processes? Where are we doing well, and where are there some concerns? And where you see concerns, you usually see a red dot. What was so humbling for us, we had no idea, or very little, when it came to understanding what does quality of care look like and what process information that we had, which then again leads to how do we achieve the outcomes. As I've said before, where do these conversations start? They start at the frontline staff, they cascade up to the manager, the director, the VP. So we always start at where the work is being done and cascade it up. When it comes to the provincial leadership team, which is all those CEOs from those health authorities, clinical leaders from the provincial organizations, and the ministry staff, this is where we reflect and we start developing strategy based on what we've heard. These pictures just show the massive amount of yellow stickies and pink stickies and thinking about how we do this. But then after we've had a couple of days meeting, we go back to where the work is, and we say, okay, now that we've met as a system, what does this mean for back home? How can we do that? Because you know what? We actually had to negotiate some of those discussions. We had to negotiate on some of the priorities. And it gets messy here, and it's supposed to be messy, and it's supposed to be uncomfortable because that's just the way it is. After we've had those dialogue conversations, we then go into finalizing and deploying the plan. And it really looks at who's accountable and setting those expectations around accountability, as well as a method for course correcting and reviewing progress. This is a very exciting slide, not the keep calm and carry on improving one, but the other two pictures, because those are actual pictures of the visual daily management that we now have in our health system. So you can go to you can go to many, many workplaces and see visual daily management in action, where people are tracking their progress on quality, safety, patient experience, workplace experience. Those conversations then cascade up to that middle picture, which is a picture of a CEO in a regional health authority who has weekly wall walks, just like Virginia Mason. Every Tuesday at 7:30, each CEO of a regional health authority or their designate is having a weekly wall walk on their performance and how they're doing and where are the stuck spots. And where there's a stuck spot, they then have corrective actions. I don't have a picture for that last bullet. Every quarter, I and my colleagues are down in Regina, the capital city in the province, where we are meeting at a provincial level. And each and every one of us CEOs, we have ownership on a target, on an improvement initiative. And if we're not reaching those ambitions, then we have corrective actions. But what's really rich about these conversations is they're no longer, what the heck are you doing? Why can't you do better? It's, how can we help? So very quick example, one of our regions was struggling with surgical wait times. What happened in that conversation? CEOs reaching out saying, I have OR time in my region. Let's brainstorm about how we can possibly offer choice to your residents to come to our region. This is a very busy slide, and so will the next piece, but this is a critical tool that's used in strategy deployment, or Hoshin Kanri, and basically it is a one-page expression of what are you trying to accomplish in the next 3 to 5 years, how are you going to know that you're accomplishing it, and then in the next 12 to 18 months, where are you focusing? And I'm just showing you these just so that you have familiarity when you have the slide deck, that you can, follow up with me and ask questions about how we've been doing it. Our foundational strategies are the Triple Aim Plus. How do we ensure better health, better care, better value, better teams? When we go to 3 to 5 year outcomes or results, this really is at the outcome level. So how do we want to see the patient experience in 5 years? What do we want to see in terms of the quality of care for mental health patients or residents? When we go to the 3-year targets, they're really specifying those specific improvements that are needed to achieve those 3 to 5 year targets, and they start road mapping what we need to do. And again, there's progress and monitoring of those 3 to 5 year targets. And last but not least are the 12 to 18 month Hoshins or breakthroughs. And I'll be honest with you, we made a lot of progress in better specifying the outcomes and the improvement targets. We're not very good yet at the 12 to 18 months because they're still feeling a little bit motherhoodish, and they're not concrete enough to actually ascertain what do we want to see in 12 to 18 months. But we're getting better, and like I say, we're a work in progress. So this is where we think we are at. Will we go back? Absolutely not, but we have a lot more improvement yet to do when it comes to thinking strategically as a health system. And what's really critical is that we are now linking will, ideas, and execution. Because we were really good with will, we were really good with ideas. What this is doing, and the parallel massive effort that we are undertaking in terms of using lean methodology across our system, across the 44,000 people that work in the system, is really all about action. I love this slide because my province is more commonly known for its agriculture, but when I listen to and participate in the conversations, I do see that alignment and that ambition to think and act as one. Relationships, 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 I can't say that enough, and this is really forcing and nourishing the relationships that we need to have. I talked about discipline earlier. This Hoshin Kanri process, as well as using the lean methodology and principles, requires a discipline that we are not used to, but we're not running from it because we're starting to see some really early and promising improvements. And I obviously spoke about curiosity. So I have a few minutes, and I left in my presentation, and I am the only person from Saskatchewan today at this conference, and I was feeling terribly, terribly guilty about that. The reason why I'm the only person from Saskatchewan, one of the big reasons, is yesterday was one of those quarterly reviews. And all my CEO colleagues were, again, in Regina, presenting on the progress that they're making and the challenges that they're facing with reaching the ambitions that we have. So they're not here, I am, but I have some words from my colleagues that I think really speak to what we are experiencing so far and do a much better job than I've done in the last 15 minutes to talk about our journey.
Regions in the past and the Ministry of Health, we all did our own strategic planning. And then I can only speak to my region. We wanted to have a little bit of something for everyone. So we had a plethora of strategies and priorities, and when everything's important, nothing's important.
Well, I've worked in healthcare for a long time in several provinces, and one of the frustrations I had, because I always had an interest in planning, but I knew that whatever I was doing was not reaching where it really mattered, which was the point of care and service. And so many of our staff came to work every day wanting to do a great job, but had no interest and didn't see themselves in our corporate plan.
What the Hoshin planning process has sort of allowed is for us to talk to our frontline staff about what do they see as their needs, what do they need to feel successful, and being able to take that back to the provincial level and have the discussions as to where that fits into the provincial picture is really important, I think.
That's the beauty of this new methodology. We hear those voices informing our decisions at a very high level within the province, but more importantly, in the catch-all process, where we actually go back, validate our initial decisions, and then really drill down in terms of how we're going to deploy our plan. Our goal is every single person working in healthcare in this province sees how he or she contributes to the provincial plan and the regional plan. We're working hard at redefining the roles of our leaders, defining standard work for leaders. So, for example, my senior team now on Monday morning is a meeting-free zone. We have a telephone huddle, and then the expectation is every one of us goes to the Gamba and talks to patients, families, staff. Increasingly, we'll go to the wall, that is at a local level. That's changing our job.
In days gone by, I would have said at the board table, well, we've got a few people waiting. We have a few people on our surgical wait list. I can tell you today I have 102 people waiting for surgery longer than 6 months. We communicate that across the organization and to our board of directors and the Ministry of Health. We are all responsible for making improvements in those areas and meeting our targets.
What excites me the most about all of this is 5 years ago we were doing a lot of quality work in our region, but I never really got the sense that outside the region we were doing the same quality work that the other regions were doing. So now that I'm in a room with all the regions together and some of our, a lot of the providers and decision makers, I really see that we're all focused on the same goals, and I know that what we're doing in Cypress Health region, we're helping out some of the other regions with their goals, and we can share some of our experiences. So as a province, I think we'll get ahead a lot quicker.
As a board chair, I'm a lot less frustrated. I have been on the Regional Health Authority since 1998 and have seen a lot of changes and a lot of things tried to get the province to move in one direction. And quite frankly, there was that points in time where I really felt that I was really just spinning my wheels and didn't know why I was participating in the Regional Health Authority. But now I feel involved. I feel like I have impact. I feel like there's logic, there's rhyme, there's reason, and I can see things happening in my community, which is the whole purpose why I ever volunteered to be on the Regional Health Authority in the first place.
I've never been more excited about my job. I love my job. And frankly, I was at a stage where I was thinking, maybe it's time to hand over the reins. I wouldn't want to be anywhere else. So people are going to have to put up with me for a few more years because I want to be part of this. I want to see its success. So at a very personal level, it is the most satisfying thing that I've ever been associated with.
I am a single mom of a 3-year-old daughter named Alina with cystic fibrosis. She is 100% my drive as to why I decided to get involved. We need to be educating our public about the changes that are going to happen. We need to not just introduce the strategic plan to the public, we need to educate them about how we got there, who was involved, and what this means for our province. It'll be excellent in the coming years to be able to tell my daughter that I was able to witness this come to light and to be able to share that in the upcoming years with my friends and family.
So it's wonderful that the last words do go to Kim, or as we call her, Alina's mom. we have just started to really meaningfully involve patients and family members as part of the strategic planning process. When it comes to our daily improvement and using the lean methodology, we do not have an RPIW or a rapid process improvement workshop without a patient and family member. If we can't find a patient and family member on those week-long improvement events, we don't have them go forward. So there again, I think, is our commitment to patient first. And when we hear Kim and others speak about why what we're doing is so important and we can't do it without them, it gives me the fuel in my belly to keep plugging on this long, not easy journey, but so worthwhile. Thank you very much.
Thank you very much, Bonnie, for sharing those challenges. I mean, it was amazing that you were able to get all those people together. Can I bring you back to the early slide when you say you got 250 leaders together to start at the beginning? Tell us about that experience.
That experience, it just seems so natural now, but again, 5 years ago, leaders did not want to come together. I was even told to my face, do you know how much time this is costing the health system to have me in this room? Do you not know how important my time is? And those earlier conversations did not have the patient family member in the room. So we went through that and we struggled through that, but there was a resolve, and leadership came from everywhere. We have a fantastic Deputy Minister of Health as well as a Minister of Health, and that was really critical. When you talk about relationships, we were very intentional that if we were going to even try to transform our health system, you had to have everybody in the room. And the unions, they had to be in the room. The medical leadership has to be in the room. And so, again, they were crucial conversations because we weren't always in the room before, and it was so easy to say, yeah, those physicians, or yeah, those darn unions, you know. And coming in the room forced us to have the crucial conversations. And we're still having them, absolutely. So.
Thank you very much. I'm sure, I mean, there are lots of people who have tried to engage with this type of transformation. We have a question here, actually, and I'm sure there are other people who would like to ask you about that as well. So a question on the front.
Hello, my name's Louise. Found that really interesting, thank you. And I was going to ask about patient involvement, but that obviously came right at the end. But my question is, if I asked you, what difference has it made to Mrs. Smith, who has multiple comorbidities, what would she say about this new system and how it's affected her?
It's not going to say, Mrs. Smith won't say as much as I'm wanting her to say in the future, if I may put it that way. Mrs. Smith will be able to say very narrowly when her experience when she has an experience in hospital, it's getting much better. It's getting much better because tests aren't being repeated. The flow through the hospital is improving. But absolutely, her time in hospital is this much of her entire experience. So one of the strategies for this year is very much on redesigning our primary healthcare system. And we're looking at all the best practices from South Central Foundation and others to say, so how do we deliver safe, patient-centered, timely care with specific focus on a number of chronic diseases. So we're not there yet for Mrs. Smith, but we are as part of her journey. So that's the honest answer to that one, not as much as we need to.
Okay, let's see, have we any thoughts on Twitter here at all? Any words from Twitter? Teresa, have you any thoughts there on Twitter?
We've got themes coming through, themes for me too, about when everything's important, nothing is important. I think that's a really crucial thing to remember with project work. And that what you said about what are you doing, when people keep asking, what are you doing, why can't you do better, that was changed to how can we help, which I think is a really crucial quality improvement message as well.
And really the foundation to both of those pieces is relationships. Yeah. And it's never easy to say to someone, your priority is not a priority. But when you've been in the conversations and when you've been together to mash through it, if you will, you can work through it versus that consternation. And the other thing is what people are starting to see with the really huge effort that we're embarking on with using the lean tools is this appreciation that daily management does not stop, or daily improvement does not stop just because you're not a breakthrough. And I say, be careful what you wish for, because when you're a breakthrough, there's a lot of scrutiny. When you're not, you can do some pretty impressive things, and that's what Dr. Toussaint had reminded us, is that daily improvement is really where the action and the phenomenal improvements happen.
Bonnie, thank you very much for sharing your experiences. It's obviously been a huge challenge and a great success, so congratulations. Super. Fabulous. Wow.